All right. Hi, everyone. It's great to be here. So I'm going to try to talk for just like 20 minutes and then open it up so we can have a conversation and take it wherever you all would like to go. But I'm watching my time because I've learned the longer I'm a professor, the more long-winded I become. So I'm going to try to really keep myself down to that 20-minute mark. So I run an initiative at University of Michigan called Poverty Solutions. So President Schlissel speaks quite eloquently about how major public universities should be about trying to tackle some of our toughest problems. And he got roundtables of faculty together from all across the university to say, what should we try to tackle? In a different example, recently we've been doing a lot of work around environmental sustainability, including putting a goal to make our campus carbon neutral sometime in the future. But one of the major issues that he felt like people were doing a lot of work around was poverty. And they wouldn't necessarily call it poverty on campus, but they call it things like trying to figure out better ways to build better and cheaper affordable housing, or trying to figure out ways to make our public transportation systems work better, or better ways to connect people to economic opportunity or education. And so he gave a charge to what became Poverty Solutions, which was to partner with communities and policymakers to find new ways to prevent and alleviate poverty. It's a goal of getting past sort of issues of poverty measurement and the causes and consequences of poverty. I'll give you the sort of punchline on that. Poverty is bad, especially for kids, right? To really try to figure out what we can do about it. And so we fund work, especially all across the state. We're starting to look into some new ways to attack the opioid crisis with what's called community health workers, which can be folks recruited from a community and trained to provide preventive health care services. Our signature initiative is a partnership on economic mobility with Mayor Duggan. I now have about 4 staff members embedded at City Hall in Detroit, trying to work on concrete challenges, helping to integrate the homelessness system data so that the different shelters are talking to each other and families can find a place to stay. Working on digital inclusion. So we have a guy who we recruited from Cleveland who's working to expand broadband access across the city. And a variety of other things with the goal of really trying to tackle the concrete challenges that families face. So I actually grew up in the Episcopal Church. This is my dad's Episcopal shield tie. So it was nice to have a very relevant occasion. And my interest in poverty, trying to understand what's going on with the most vulnerable families in society, really come from 2 things. One, my dad had sort of an abrupt career shift about halfway through my childhood, and we had a couple of years where I think we were probably in poverty, or maybe not quite below the official poverty line, but somewhere close. One way or the other, we didn't have what we needed. And but in our case, when we couldn't pay the rent, right, or didn't have enough to keep on going, we could call Grandma and Grandpa, right? Because my social network, the people in my families beyond our immediate family, had resources. And that's actually one of sort of those defining features between what I think of as like compounded disadvantage, in a place where people of color often have less resources, even when folks among those who have low income. Where I was contextualized in a network where I had resources to pull on. I didn't have to go to the public welfare office to get food stamps. We just had to call Grandma and Grandpa to get the rent paid for another couple months while we got back on our feet. So that was a defining experience for me growing up in the Ann Arbor, sort of Ypsilanti area, and knowing that I certainly wasn't upper middle class, I certainly wasn't middle class, and when you live in a place like Ann Arbor, those distinctions become quite clear, right? But I wasn't sure if I was really poor. I wasn't definitely the most vulnerable because we had this safety net that we could rely on and that shielded us from some of the bigger challenges faced by many, many families, even in our community. And I think another thing that really pushed me down the road of poverty and doing the work that I do was my faith, right? And growing up in the church and sort of trying to understand where did Jesus really spend his time. And it's clear to me, at least for me, in reading the story of Jesus and in reading the story of our collective faith, that compassion, right, and work on behalf of the most vulnerable in society, whatever that society might be, is an important foundational principle, right? That is, I think, a big part of what we're called to be. So early in my life, I thought I might be sort of headed towards the trajectory of becoming a priest. But somewhere in there, sort of my call said, you know what, this is the part of Jesus' teaching that I really want to focus on, is the work of trying to figure out ways to lift up and be close to those who are the most vulnerable in society. But I think as I've gone along, I've understood another piece of that teaching, which is Jesus doesn't just call us to do things for the poor. He doesn't just call us to be compassionate, right? If I had one word to describe sort of the way Jesus approaches work, it's compassion. I think that he called us to be in relationship with folks who are the most vulnerable in our society. Not just doing something for them, but really being connected to them. And in the trajectory of my life, I started out as a caseworker. I had some personal experience, right, of not having enough. Early in my career, I was a caseworker helping people deal with their emergency needs. But then I went into the academy because I thought, as I was helping people pay their rent, not get the utilities shut off, I thought maybe there's some structural things that we could change so that families don't end up in experiences like this quite as often as they do. And I got into the academy, and I got into my office at the University of Michigan, sort of thankfully, blessedly getting a job right after I graduated. And I started studying poverty in a pretty nice office at the corner of South University and East University in downtown Ann Arbor. And when I got really frustrated, right, with a statistical model I was working on, I'd go down to the Espresso Royale and get a cup of coffee and sort of clear my head. And I do think that I did good and meaningful work during that period of time. But this experience of $2 a day, the book that Kathy Eden and I wrote, was an experience where, you know, I was really sort of coming into that project focused primarily on looking at large-scale data to try to understand what's going on in society. And she had this research technology, which was when she wanted to find out things about what poverty was like, she'd go out and like talk to people. And so we, in this book, tried to marry both of those things, right? We tried to look at large-scale data, and we tried to go out and actually talk to families. And in going down to Chicago and meeting Jennifer Hernandez and Susan Brown and Madonna Harris and some other folks whose stories aren't told in the book, and then to Cleveland, and then to Appalachia, and then down to the Mississippi Delta, what I really found was that sometimes I didn't even know the right questions to ask when I was in the comfort of my office in Ann Arbor. Sometimes I didn't even know the right questions to ask. And so from a research perspective, or maybe just like really searching for a deep understanding of things, being in relationship, I have found, is critical, right? Sort of taking me back. Maybe this is part of my evolving understanding of what I think Jesus calls us to do. I'm just going to give you two quick examples. The first is, as we're talking to families with very, very low cash incomes, right? Families trying to survive with virtually no dollars in their pocket at any time. As we got to know families, we're doing a lot of this work in the summers, and you know, I noticed sometimes a little divot on the inside crease of the elbows of the moms who we're getting to know. And of course, I'm a poverty expert, but my narrative when I saw that divot the first time immediately went to, oh, that's a drug track line, right? There's probably some experience with some sort of drug abuse in the past. But as we started to talk to families, we learned that those little divots were scars from selling blood plasma so often. So among families who don't have cash, that are sort of trying to survive just on food stamps, now SNAP, one of the primary ways that you can get a little cash in your pocket is to sell your blood plasma. And for Jessica and Travis Compton, Travis had been working at a job at a fast food joint, and his hours have been cut down to 0. They've been surviving on nothing. And when I interviewed them in their place, Travis's eyes are always sort of darting towards the window of their apartment. And I realized finally that it's because he never knows when the sheriff is going to come to evict him from their place. The only money they had coming in the house was from Jessica selling her blood plasma twice a week, every week. And she would, they'd buy with their SNAP dollars an iron-rich breakfast bar, because your iron levels have to be at a certain level. So I sort of came to think of that as like a works expense, right? Not like steel-toed boots, but an iron-rich bar to get that iron up. And they would check out a book from the library so that she'd have something to read to help bring her heart rate down. Because if her heart rate was too high or her blood pressure was too high, she couldn't sell her plasma. And the only thing worse than having to sell your blood plasma to survive is not being able to sell your blood plasma to survive. So that's when I can go back to the data, right? And I'm saying we're seeing all of these people who are going for spells of time when they're virtually surviving only on this $30, maybe if you're lucky, $50 coming in. Has there been a change in the landscape? So luckily, the Trade Association for Plasma Companies is actually quite proud of the fact that there's been more than a tripling of plasma sales in the United States over the last decade or so, from about 12 million plasma sales in 2012 to over 40 million in 2017. And the U.S. actually accounts for 70% of the world's plasma supply and only 40% of the demand. So these centers that are pretty much only in poor communities, the plasma that's collected is exported all across the world for what is an industry that's like $100 billion, right? It's a huge industry. So when the book came out, the Plasma Association sent us a very sternly worded letter saying, it's fine to talk about poverty, but could you please mention that plasma is an important component in a lot of life-saving treatments. So plasma is an important component in a lot of life-saving treatments. I just don't happen to think it should be, basically a cash safety net in the United States. And I think it speaks to a lot of this complexity, right? So plasma companies will say, this is the way that people can make money and save lives. And that is absolutely true, right? The plasma that is collected goes into treatments that are incredibly important, especially to folks with hemophilia and other sort of rare diseases that require a lot of this. At the same time, this is an extremely profitable industry, right? That's built off of the blood of poor Americans. And it's something, most importantly in my mind, that I, as a poverty expert, knew nothing about before I actually went out and asked. Certainly, whatever sort of a stance I might take on this, if I really want to understand what it's like to not have enough in the United States, this is something I should know about. And I didn't until I went out and asked. And I wouldn't have known had I not gone out. So I'll give you just sort of one other example. As we've been doing work in Detroit, I'm going to ask you just to imagine for a second, what are some of the biggest barriers to escaping poverty in the city of Detroit for somebody? Somebody wants to work, they want to escape poverty. What are the major barriers? Just think in your head for a minute. I can tell you when I did this exercise, one of the things that didn't make it onto my list was auto insurance. So auto insurance, we now know at the center I run, Poverty Solutions, we've recently released a report about the high cost of auto insurance and the barriers to escaping poverty that it causes. Michigan now has the highest auto insurance in the country. And Detroit has the highest auto insurance in Michigan. So a policy that costs like $1,200 nationally and about $1,500 in Cleveland costs $5,400 in Detroit. Now this is one of those examples where like a policy that had a good intention at the start, right? Where we said, you know what, if you get in an accident, you shouldn't have to worry if you have permanent damage, right? You should be taken care of. That was what sort of propelled our no fault. And we wanted to get rid of lawsuits, which it didn't work out actually in that way. But this is now a policy that's untenable. So let's say you're making the median income of about $30,000 a year in Detroit, and your auto insurance policy is taking up 18% of that, your entire annual income at $5,400. What would you do? What do you do? Well, there's a lot of things. Maybe you don't drive. Maybe you miss appointments, right? We know a huge fraction of Detroiters don't have the transportation they need to get to appointments. Or maybe you drive uninsured. You think, maybe it's not like I'm doing a cost benefit, I'm going to decide to drive uninsured, but maybe it's like, I can't, if I don't get to my job, I'm going to lose it. If I lose my job, I'm going to lose my house. And there's no public transportation to get to my job because a lot of the jobs actually are outside of the city that I can get. So today, I'm going to drive uninsured. And then tomorrow, I'm going to figure it out, right? But what are the chances I'm going to get caught today? Well, then in Michigan, we compound that with about a decade ago, the state was running low on money. And they said, you know, what can we do to raise the money we need? That's when we created something called driver responsibility fees. And driver responsibility fees basically just jacked up the prices of all these sorts of tickets that you get for things like driving without auto insurance. So you can get charged up to like $1,000 if you get caught driving without auto insurance. So somebody gets pulled over because they have an out tail light, right? While they're going to work, they're driving uninsured. It's a huge ticket. They didn't pay for their auto insurance because they couldn't afford it. They're not going to pay for the ticket. And then they lose their license. This is what I call a cycle of poverty. This is a cycle of poverty. And often, was that a question? Or tell me.
Yeah, they're picking it up. Okay, the handheld mic. Yep. Okay, so I'm sorry to even stop you there, but I just wanted to let the congregation know that we've had 3 employees who are people of color that could not get here to work because of having suspended licenses. And there's also a final thing that happens, and I'm sorry to jump in, Luke, but what happens also is that a lot of the police go to places like high school pickup places, like where the parents would drive to go pick up their kids, and then pull over fathers primarily who are picking up their children, and they for things like, you know, I thought I saw a taillight out kind of thing, and then they ask for the license and they get the ticket because then the police achieve their quota, which they're supposed to do, and it continues to cycle. So I just wanted to add, because I wanted to bring that home to write exactly how we operate here.
Yeah. So luckily, in the fall, we did away with these driver responsibility fees. But I can tell you at the state level, so people still have to reapply to get their licenses back. They're still at risk of being caught up in getting these very large tickets. But we at least sort of got rid of one layer. But the final challenge to that was how much money the state was making. About $90 million a year, right? Which is a decent fraction of, it's a meaningful chunk of money for the entire budget of the state of Michigan. And trying to figure out how we were going to replace that money was the biggest challenge. So to me, right, really trying to understand these things, really trying to be in relationship with folks is the only way that we try to solve and are able to have a chance at tackling some of these challenges. I was really proud of another thing, actually, that we did in the fall at the state legislature. So in the fall, the state of Michigan approved Medicaid work requirements, which I don't agree with, right? Just because I think they're a matter of bad policy where lots of families just drop off benefits. And I think we can do a lot more to support people in work. But Mike Shirkey, who was a champion of those Medicaid work requirements, also was a champion of a bill that I really like around adding dental therapists to the workforce, right? This is like a mid-level provider in the dental field that works under a dentist to provide care, right? And it can be less expensive, and hopefully the goal is to sort of broaden access to an important element, right? And we saw a lot of the families that we got to know had major dental problems. Ray McCormick had lost all her teeth by the time she was in her mid-20s. She had some major dental disease. And so these dental therapists, right, again, a lot of times when we talk about how do we really change systems to work better, these dental therapists create a little bit of controversy because it sort of shakes up a system, right? But on the other side, they can bring people together that are maybe strange bedfellows, right? And so in this case, I wrote some op-eds, some public op-eds, saying I didn't like Medicaid work requirements. I didn't agree with Mike Shirkey on that. And on the other hand, I really agreed with them, right? And appreciated his leadership for the state for taking a strong stand on this other issue. And so I guess that's the final lesson for me, is that Jesus doesn't just call us to be in relationship with the most vulnerable, but I remember also something about him being in relationship with tax collectors, right? And it's my understanding that tax collectors back in that time, they were either not liked sort of by society because they were sort of the stooge of the Roman Empire, or they weren't liked because they were taking, they were getting a piece of the pie, right? They were sort of taking their slice on taxes as well. One way or the other, right? Can you imagine how controversial it is? You've got this guy who's walking around, right, having dinner, being served by some of the most vulnerable, and also sort of calling this guy who's a tax collector out of the tree and saying, hey, we're going to your place, right? And so it's in that lesson of sort of trying to bring people together across the spectrum, right, to really understand, to really find common ground, that I think we have a chance of tackling some of the toughest challenges we face. And that lesson, maybe even just a little bit surprisingly for me, that's sort of gone through a lot of this exercise as an academic, and why I appreciate being able to come to talk with groups like you, brings me right back to where I started in the faith that we hold together. Okay.
Thank you. I'm sorry for interrupting you. It was one of those key moments where it brought it home for me, and you'll be all proud to know that we actually stepped in and paid the fines so that they could get to work safely. But it was something that, again, you never know until you know it. And then also the systemic racism in the city, because it was just some kind of weird thing that, everyone there was a person of color driving and were pulled over. And it's hard to argue with the facts. Just being entirely honest. Any questions, comments, feedback? I just saw a bunch of questions, so this was the first person.
I think I was close to 20 minutes, but.
Yeah.
You were marvelous.
Oh, stop.
Annie's a professor.
Even professors can be interesting.
Hey,
Hey, how's it going?
Right? Wonder's never seen.
all right. I'm a clinical social worker and psychotherapist. So, I see people who have insurance. I do not see people who don't have insurance. But that said, I have a significant amount of Medicare patients in my practice who are disabled and living on Medicare. And one of the things I have learned from being with them is that $5 makes a lot of difference to these people. $10 makes a lot of difference. So, for example, I have a woman who lives in HUD housing. She's 52, has more medical problems than anyone should have, lives on disability, and they're going to raise her rent $5 a month. And then the auto insurance is going to raise it. She can't afford it. You know, for most of us, $5 a month is nothing, or it means one less Starbucks. But $5 a month or $10 a month, which I'm sure the people who are making policy think is nothing, makes all the difference to these people about whether they can continue to live, to pay their driver's license, or whatever it is.
Great, and I'm going to just go right, because that was a comment, I'm just going to go right to Hunter.
Hi. Thank you. Thank you for bringing this whole conversation. I have my daughter with me here today because she's one of the most empathetic people that I know. This is Paloma. And we pretty much every day pass by people in our very neighborhood who stand on a corner looking for some handouts and clearly have with them everything that they own. I have so many questions about that, but I want to ask the broadest one, which is that dual view of giving to people who stand and ask at the corner of Woodward and Lone Pine perpetuates the problem versus the very real and very human instinct to care for those of the greatest need around us. What are your thoughts on that beyond all the very, very many other questions we have?
Yeah, so I think it's important to remember that the folks that you might see at the corner standing are not always representative of the overall population of folks who are struggling, right? The folks where $5 really does make a huge difference in a month. And that we know, so my colleague, Laura Lane, did a survey and ethnography of panhandlers in Austin. And the things that she found was that a lot of them were engaging in substance use, but a lot of that substance use was self-medication, right? Where they didn't have any, there's a lot of chronic pain. Folks who had tough experiences that had more health problems than any one person should have, and they were using substances as a way to deal with that. There was also a big connection with veteran status, right? So you have an awful lot of folks who, for some reason, filtered out of the military without getting access to the health benefits that they should have. So in our view, we actually don't take a strong stance on what you should do, right? We both don't feel like you should be compelled to give if you're deeply uncomfortable with that. On the other hand, we're not as worried that it sort of perpetuates the problem. So I think that you should feel, to me, I think you should feel compelled to do what feels right to you in that circumstance, with one caveat, which is when you have the opportunity, my feeling is that you should engage that person as a person, right? What I would rather you not do, I know sometimes, right, we're super busy and we're walking past, I'd rather not sort of have folks sort of, look at the pavement or try to ignore, right? But rather connect with that person as a person. Because in our experience, right, those connections can lead to something, right? And they can humanize in a way. So giving or not giving, right? You can feel, if you're not comfortable with giving, you can totally feel free to find a great organization, right, where you can do that giving. But trying to figure out ways, maybe not every time, but different ways that you could actually connect with folks as people and hear a little bit about their story, I think will do a lot for you and do a lot for them too. And keep it up, Paloma.
Alyssa, did you have a question?
No.
Oh, sorry.
At the right table.
It was over here somewhere.
It's okay. So I'm a palliative care physician, and what I'm seeing is the poverty of dying and resources. And I've had times many times actually, where patients are telling me that they need hospice because they can't get to and from a doctor, and they can't go and get their meds, and they can't afford them anymore. And they're making that decision to go on hospice, even though it's not their personal goals in terms of their life. So they still want more treatment, but they're making the choice not to because hospice will provide for them. You know, Medicare pays for that 100%, which is a great thing, but people are making that choice because of not having the money or not wanting to be a burden on their family in terms of finances. We've had situations where patients who are not eligible for hospice, who are begging
Yep.
to be certified for it.
Yeah. Well, I don't have great insights into that. I mean, that is super insightful, and I appreciate the opportunity to think about it. I will say that we have seen in a lot of cases, you know, we have this great picture of this woman who we write about at the start of our Mississippi Delta chapter, who has no money coming into the household, right? She is the one who actually has like a little candy shop for the neighborhood, and she buys a little bit of candy for her, off of her SNAP card, and it's like the neighborhood store in this basically place where nobody has any money. But her family is surviving on almost nothing. But she, we tallied up and have a picture of her with her 9 different medications. So we have, at times, a healthcare system that doesn't make a lot of sense to me. Now, my kids say, Dad, you're a doctor, but you're not a real doctor. So maybe I'm not in a good place to make these assessments. But I think the evidence is quite clear that Mary would be better off if we invested a bit more of the fairly significant amount of money that we're investing in her through these 9 different medications in income support, right? If we gave people a little bit more money, actually, I think the evidence is that can help people's health and maybe could help rationalize what we have as overall an expensive system where she can't get the medication. Now, I don't think her life is such that, again, I'm not a real doctor, but like my assessment is, how is she gonna keep on going on those 9 different medications? What are she can't get to the place to get her medication, right? Is she gonna skip 3 of those? How are those interacting with each other, right? And what is this sort of unstable treatment regime gonna do for her? And I don't know exactly how to solve all of that, but I'm confident that if she had more money and she was able to stabilize her life in a way, that might actually have some positive health effects above, well beyond what sort of the way we're paying our resources does now.
We have, Linda and CJ, and who else has a question? All right, Francis and Patrick. So what I'd like to do, and I apologize for intervening in this way, but I want to actually hear all 4 of them because I know you have so much background that you'll be able to handle each of them with exhaustion, and I want to make sure everybody gets a chance to speak.
Got it.
So we're going to go seriatim.
I'll be fast. I think it's wonderful to deal with the victims, but that's palliative. What you need to deal with, and I thought this for a long time, you need to deal with the victimizers. And who are the victimizers? The government, the insurance companies. This is a country, I mean, I hate to say this, where we just paid $430 million to a man who picks up a stick of wood and hits a ball with it. He does nothing for society, nothing. And I hate to be honest, this is my soapbox here, but the person who told me this, the newscaster who mentioned that, said as a tale on her little announcement, congratulations. I mean, if insurance companies can redline a district to charge more insurance, why can't they redline a district to charge less? These are companies that make a lot of money.
That is beautiful. CJ, we're going to keep going, and these are great, and I apologize for moving us through this, but I want to make sure that we all get a chance to.
So I appreciated the distinction that you made between the 2 different styles of research. And I recall in some reading where there's sort of that distinction within sociology too on how you address this issue. That is, frequently putting government programs in place is too removed from the problem, as you indicated. So you look at it as a money issue, And that can certainly help, but sometimes it doesn't because you're too far removed from the people's needs. And that sometimes keeping it close to the community locally is really kind of the way to approach the problem. So I'm wondering, in terms of your research and how that plays into social policy, how the two different styles of research maybe plays into a different way of approaching the issue.
Beautiful. And now we go to Francis.
So two questions. Your center is solutions for poverty, I think. So in terms of the answers, I guess is the question. I'm worried that the work is not really a solution to poverty. I've interviewed some low-income people around food insecurity, and frankly, no matter how many hours they work, they don't make enough to be able to pay rent and transportation. And food is sort of the least of their issues. There's a lot of free food around. And so just, they're not going to be able to work themselves out of this, or their children out of this situation. And the second question is, in other parts of the world, there's been some emphasis on microloans to women. And I'm just wondering about the role of that in this country.
Thank you. And then Patrick.
Well, I had two thoughts, two questions. One being the idea of having a guaranteed minimum income for people. And do you think that that would work? In other words, would the money that they are paid end up being enough of an economic jolt that it would pay for itself? The other one being, you're in education, and we have 2 kids in Germany, and over there, it's all paid for, college. And they're also put on a track. If they're not on a college track, they're on a trade. Thank you. So,
And before we go to you, because we have 5 minutes left, and I know you can answer all of those questions, this is not going to be problematic. The one thing I want to say, and I've got to get ready for the sermon, and you're welcome to join us afterwards, is what I see is an immense bank of knowledge and resources in this room. And I know these people well, I know their background, and I know what they can do. Can you give us one thing that we can do as a congregation that can move us one step closer to addressing issues of inequality and poverty in a real way? Because for me, if we don't come up with an action item, we're just wringing our hands.
Yeah. Okay. All right. Woo. All right. Here we go. So I think focused on understanding. I think you're absolutely right that we have to contextualize most relationships or most systems that aren't working well have someone who's being victimized and someone who's victimizing. But going back to, I think, Jesus's teaching, I think we're called to try to understand both, right? And in most cases, I think we can have a deeper understanding. It's not to say that we shouldn't hold auto insurance companies to account, right, for using characteristics that redline. That we shouldn't try to understand sort of economic systems that don't work, but I guess we have to sort of situate in the complexity to find the answers, right? And understand that I think most of the people who are doing the victimizing maybe don't realize it or don't intend it. Sometimes there is, I think, ill intent, but trying to understand exactly what's going on in a system and where it went wrong, to me, is the key. So, but I think really improving these systems, right, really making things work, often means that it's not just a matter of sort of bringing folks up from the bottom. It is, as we say in this auto insurance brief, some people are going to have to take a haircut. And in the case of this, it's not just auto insurance companies, but healthcare systems, right? Because the way that we set up this law was that if your auto insurance pays your medical bills, they have to pay 100% of whatever the hospital charges them. So guess if the hospital, who they want to have pay the bill, right? Because if they charge your health insurance, they're only going to pay 60%, right? So these systems we have to write, and it's going to mean somebody taking, getting a worse end of the deal, I guess. In terms of government role, I've come to think that the federal government should be about trying to stabilize families, right? And having sort of a set of policies. I've come to sort of think that government, the simpler, the better. And to me, right, because I'm interested in families with kids, I'm interested in a variation of this guaranteed basic income, which is what virtually every other Western industrialized country does. It's called a child allowance, right? Where it's a universal policy that says, hey, raising kids is expensive, and the government has a self-interest in making sure that it's done well, and it takes money. So every kid is going to get $250, right? Parents are going to get a small monthly stipend to be able to spend on their kids. And if we did that, $250, $300 a month, we would cut child poverty by about 40%. We'd cut deep poverty, which is about half the poverty line, by 50%, and we'd eradicate the type of $2 a day cash incomes that motivated our buck. And a couple of years ago, sort of that type of idea that the United States would have a child allowance was a pipe dream. But I think through work and a deeper understanding, right, actually we have a bill called the American Family Act that now has support of 38 senators in the US Senate and about 176 House members that would do exactly that, right? So that's at least to say that these types of solutions are now on the agenda. But I do think, I want the federal government to stabilize things, to treat everyone the same, right? I think the more you have policies that are equitable across the board, the more support that they get. I do think when we're talking about these systems, it really does take local change, right? It really does take, because a lot of the systems that are challenging for families are sort of determined at local or state or county government. So auto insurance is an example where that's a huge barrier to economic mobility in Detroit and across the state. It's not a big issue in Cleveland, right? So it's something that we have to tackle as a state. Exclusionary zoning laws is another example of that, right? We have an affordable housing crisis in this country, and a lot of it has to do with the way local laws are set up to make it so you can't build certain types of housing. And some of those have discriminatory sort of reasons behind them. Some of them are just people not thinking, right? But that's something that we can take a look at our local level and say, hey, are we doing this the way that we think that we should? In terms of work, that's a challenge for me because a lot of the families, right, is work a path out of poverty? When we talk to families in our book and we said if we came back in a year and things were going well for you, what would it look like? And to a person they would say, I'd be working in a stable job making $10 to $12 an hour. I'd have a place of my own, right? That was the American dream. So I do think we have to have policies that try to help support work, to help it pay more, right? But also help people stay in work. So I'm really attracted to models of success coach models where we think of like the working poor or the not working poor, but often the not working poor are folks who are working at some point recently. Even the panhandlers, right? When we look at the history, they have some work experience like in the last 2 years, a surprising number. A lot of it is trying to figure out how do we keep crises from keeping families from maintaining that work. And these success coach models are sort of somebody who can come alongside a family and be there in the moment of crisis. You'll read about a lot of those in the book and help them stay in. And that's, I think, a solution that we can look to. In terms of what I think you all should do, I have one suggestion. So I don't know exactly what it is you should focus on, but I would focus on something that you're passionate about. We had this example of the fines and fees, right, that have affected your own community. Maybe that's one. But rather than just focusing on taking food to a great ministry, I want you to do that too, right? But think about all the intellectual expertise that you have in this room. I imagine there are a couple of lawyers at Christ Church Cranbrook. I'm just guessing, right? There's maybe a couple doctors, there's maybe some dentists. Hopefully I didn't offend anyone. Some of my best friends are dentists. And so think about what you can do, right? If we're talking about systems, and systems that need to change to work better for families, are there ways that you can harness some of that intellectual capital that you have in a meaningful way to impact the system? Maybe it's in your community, right? Or maybe it's at the state level. I can tell you, if you go, we are at an impasse on this auto insurance thing right now, right? It seems like, to me, this is a solvable problem. But for some reason, it's like a huge challenge. But this is a type of group of folks that if you went and said, hey, we need to solve this, and we think X, Y, and Z are two of the pieces, right? People will listen, right? Or tax time, right? We know that a lot of the benefits that we do have for families are wrapped up in the tax code. A lot of you can get trained to do tax prep for folks, and that would make a huge difference, right? So there's a lot of ways, but use a lot of those heads and do it in partnership, right? Don't sort of assume just because you have this intellectual capital that you know exactly needs to be done, but it is a tool that can be brought to bear in partnership with other folks who are trying to fix problems. And I just encourage you, and I'm happy, you know, if you think I can be a further help in advising on different paths to help you along that way.
Thank you. It's as faithful a way as I can imagine to either wrap up your worship time if you were at the 8 o'clock service, or to prepare to worship God in heart and mind now. So thank you so much, Luke. His book that's co-authored with Catherine Eden is $2 a day. We have some copies here. Coco's got a square. We've even figured out how to use it. So $10 for this book. Otherwise, you can absolutely find it online in bookstores, and please do. And this will be the beginning, God willing, of a conversation that we will continue. Thank you so much for joining us, and thank you, Luke.